While it is a relatively common issue, pain during sex is never normal. Not that type of pain. We're not talking about the pain that may be a welcomed pain, BDSM type of pain. Pain during sex should never be normalized. It is unfortunately accepted as a normal part of being a woman or vulva owner and too often dismissed by many healthcare professionals. While it is a relatively common issue, pain during sex is never normal. Not that type of pain. We're not talking about the pain that may be a welcomed pain, BDSM type of pain. We're talking about pain that is not welcome, not expected. So painful sex, officially known as dyspareunia, is never normal. Dyspareunia can affect individuals of any gender. I will focus a lot on vulva owners, but I don't want to neglect my penis owners. Any gender can have painful sex. It's defined as recurrent genital or pelvic pain during or after sexual intercourse. For vulva owners, that can include pain at initial penetration, pain with deep penetration, pain with certain positions, pain and cramping that occurs right after sex is complete. Sometimes this can be associated with nausea and even vomiting. For penis owners, that can include pain with erections, pain with penetration, and pain associated with ejaculation or after ejaculation or after intercourse is complete. Dyspareunia can decrease sexual desire. Duh, why would you want to have sex that feels bad? Decrease self-esteem, cause significant psychological and emotional distress. Sexual intimacy is an essential part of many relationships, not all, but many. And when sex becomes a source of pain, this can lead to avoiding sexual intimacy in the relationship altogether, fragmenting the relationship significantly. In this way, dyspareunia not only affects the individual, but the entire relationship, decreasing the physical and emotional connection between the partners. Now, common causes of dyspareunia in vulva owners include, but are not limited to, vaginal dryness, endometriosis, vaginismus or pelvic floor dysfunction, where the pelvic floor muscles in the vagina tighten up instead of relaxing. Genital hormonal imbalances can cause pain with intercourse. Dermatologic or skin, inflammatory, or other medical conditions that affect the outer genital skin or the internal reproductive organs can be sources of pain for vulva owners. Common causes of dyspareunia in penis owners include some of the same things. Any skin, inflammatory, infectious conditions affecting the outer genital skin can make it hurt. I mean, if you have a painful sore on your penis or pain associated with pulling the foreskin back, that can be a source of pain with intercourse. Penile curvature, something called Peyronie's disease, can cause pain with an erection and pain during penetration. And pelvic floor dysfunctions can affect penis owners too, making it painful to ejaculate or just after intercourse. Psychological trauma may also contribute to painful sex. If you suffer from previous sexual trauma, if you have guilt or shame associated with the idea of physical intimacy, maybe because of how you were brought up or religious beliefs or whatever in your past, that could be a source of actual physical pain during intercourse. Remember, pain during sex is a valid concern that should not be ignored or dismissed. The appropriate treatment depends on the underlying cause. Some interventions may include, but are not limited to, using personal lubricants during intercourse. I say this all the time, the wetter, the better. Sex should be wet, not dry, so don't be ashamed to grab that personal lubricant. Hormonal therapies, other medications, physical therapy. I love my physical therapist, my pelvic floor therapist. You all are saints. Psychosocial counseling, sexual counseling. There are mental health specialists and therapists that are dedicated to sexual health. And in some cases, possibly surgical procedures or interventions may be recommended depending on the cause. Now, I hope this video helps somebody today understand that their painful sex is not normal and there are solutions. So hit that bell, make sure you subscribe, hit me up in the comments, let me know what you think, and don't miss every Wednesday right here, all things down there. Bye-bye.